Welcome back. Comprehensive Dental Care. The sponsors of this segment are dedicating to helping people's teeth look great and stay functional. Here's how.
It's estimated that over 175 million Americans have at least one missing tooth. So, Comprehensive Dental Care is here to educate that population on their best options.
My practice is focused mainly on dental implants and single tooth restorations and full arch replacement of teeth. I've been doing dental implants for 25 years. I am a diplomat of the American Board of Oral Implantology, a recognized dental implant specialist.
In other words, Dr. Hendrickson knows what he's doing. He's also one of the national full arch restoration trainers for Highbridge Dental Lab, which helps his practice stay focused on comfort, aesthetics, and function.
If they come in and they're wearing a denture like this, we know statistically that they've lost about 90% of their function. They've lost taste because this covers the roof of their mouth. Oftentimes their anatomy limits the stability of this in their patient's mouth, so they have to perhaps live with denture adhesive all the time.
With the Highbridge, the full arch restoration is fixated and screwed into the patient's mouth.
It's going to fit, feel, and function the most natural. It's going to give them their ability back to eat and enjoy foods.
Another reason why patients prefer the functional Highbridge system is because it supports optimal bone health.
Over time, the bone in the jaw melts away. If we take the teeth out, we know for a fact that every year the patient comes back with the denture in place, they're going to lose gum tissue and bone.
The full arch implants stimulate the bone and restores its health and functionality, making the implant last a lifetime.
You know what, if you come to me and say, Greg, you know what, the teeth are kind of worn down, it's been 10 years since you put these in, I can go ahead and remove these from the patient's mouth, send them back to the laboratory, and they literally do a retread on these. For less than the cost of a crown, you have a new set of teeth.
And maintenance with regular dentures, you're looking at $500 to $700 per reline. Now, according to Dr. Hendrickson, the process of putting the Highbridge in is relatively pain-free. Patients typically say the first 18 hours are the worst, with some soreness the next day.
The surgery is typically done in the morning, and we bring you back in the next day and we do a digital scan, and 3 weeks later we can screw your teeth into your mouth and they're done. You know, if you look at somebody's face and eyes that has dental problems, it may sound cliche, but sometimes they come in kind of lifeless because they don't like their smile. They're not happy with it, so they're not smiling. And when we can give them that smile back, their whole face lights up.
You can visit Comprehensive Dental Care for a free consultation with Dr. Hendrickson himself to discuss your needs and your new smile.
Thank you to Comprehensive Dental Care for sponsoring this segment. You can find them in Henderson. For more, call 702-735-3284 or visit nvdentist.com.